Hey guys, what's up? So welcome back to our course on universal health coverage. So in this particular course, I am dealing with everything which you need to know about universal health coverage because this is a very hot topic these days. Even economic survey finds you will find mention of universal health coverage, and soon it will become very debated topic. It will be brought upon in elections and stuff. So it is better that you have a detailed understanding of this topic because you will encounter this a lot in your mains and prelims and your interview. And even in essay writing, they can directly ask you what is universal health coverage. Trust me, they can ask you this question. So we are dealing with the second part. Already we have covered the national health policy. Now will deal with the second part of universal health coverage. So we have done like why universal health coverage is needed. We have done the background of the universal health coverage. In the last lesson, we have done the introduction to universal health coverage, and we have even done what is UHC. So now we will study why health for all is needed in the first place. Why do we need it? And frequently asked questions related to universal health coverage. So let us get started. So why do we need health for all? So there is a growing global consensus that universal health coverage is a smart investment and an achievable goal everywhere. So first of all, there are two realizations here. First, like human is a resource, and just like a resource has to be developed, so human beings can be developed by doing two things. One is their health and one is education. So if you give the universal health coverage to everyone, so it is a smart investment because in the longer run, these healthier population will be more educated, they will do more job, they will increase the GDP production, and it will eventually lead to the development of the nation. So first point is that it is a smart investment. Second point is universal health coverage is not something which will be achieved 100 years down the line. Right now it is an achievable goal everywhere. Okay, it is not impossible goal, it is an achievable goal. At least you will have to believe that. Now world leaders have affirmed that health is a human right, and no one should become poor or no one should go bankrupt once you get sick because of the cost of the healthcare, etc. And also these experts have said that universal health coverage underpins our collective security and prosperity. So as a nation, you will feel very secure and prosper knowing the fact that even the poorest of the poor have the access to the health, and they will not get bankrupt. They will not have to take loan from loan sharks, sahukar, etc. These people who will take their life for these loans. Now, universal health coverage improves how healthcare is financed and delivered. So this is like the third point, because it will also transform the healthcare delivery, healthcare financing model, so it becomes more accessible, more equitable, more effective. So otherwise, what is the point of having universal health coverage in the first place? So it will improve how the healthcare is financed, how the healthcare is delivered finally, so that healthcare becomes more accessible, more equitable, and more effective. Now, frequently asked question, lot of questions are asked from universal health coverage, from the administrators, etc. So what do you mean by universal access? So universal access literally means that everyone in the country who wants to have it can have it. So it is a concept which implies absence of geographic, financial, organizational, socio-cultural, gender-based barriers to care, etc. Basically, it will not be that only females are not getting, only males are getting, so that gender barrier will be eliminated. Only people from North India are getting, Central India are not getting. So means absence of geographic barrier. Then only rich people are getting, poor people are not getting. Then again financial barriers are there, so we are eliminating that as well. Then socio-cultural barriers and organizational barriers. So all these we want to remove, and we want to provide universal access to health to everybody. Now who will pay for universal health care? Obviously poor people cannot pay money, right? Otherwise they will go to private sector only. So access to healthcare will be paid for by the government of India. Now where will government of India get the money? Obviously from us. So with the funds generated through taxes along with an increased spending on public health to pay for the health services given to the citizens. Okay, so government of India will put out of its own pocket as well as those people who pay taxes, right? So then the system will be cashless, where the patient will not be charged any user fees whatsoever for the various healthcare services that has been provided to him. So that is important. Now there are a lot of critical areas for the provision of universal health care. Okay, so the critical areas for the provision of universal health coverage as per the HLEG. HLEG is basically high level expert group, and it needs to be addressed. Like health financing, where will the money come from? You just said the taxpayer will give, but how will it be structured, etc. Then health infrastructure, okay, you have the money, but where will you get the infrastructure? Where will you get the doctors from? Where will you get the machines from? Now health services norms, basic minimum standard of services has to be provided, otherwise what is the point of everything? Then you need skilled human resources for health access to medicines, vaccines, technology, etc. And unfortunately in India it is a severe shortage, the doctors I am talking about. Then you need management and institutional level reforms so that the buck must start to move forward, and we need to have solid progress in UHC. And finally you have the community participation, because without community participation nothing can be of success, not even the HLC, UHC, sorry. Now UHC services are delivered by, so basically the government will invest in ensuring adequate number of trained healthcare providers are there. So there will be greater recruitment and training for the delivery of services by community health worker like ASHAs. ASHAs is accredited social health activist, nurses, rural healthcare practitioner who are being given like let's say 3-year program of bachelor of rural healthcare program. Then you have full-fledged allopathic doctors, Ayush workers, allied health professionals, etc. And a trained and equipped workforce will be available at both the public as well as the privately contracted in the facilities. Now UHC service will be managed by, so basically government will set up new all India and state level public health service cadres and a specialized state level health system management cadre. So these people will be hired and they will help in giving greater attention to public health, and it will also help in strengthening the management of the UHC system. Now this human resource will be managed by autonomous specialized agencies for regulation, evaluation and health promotion. And how will be the provisions related to UHC made accountable? Now this will be done by National Health Regulatory and Development Authority, NHRDA. Now the main function of NHRDA will be to regulate and monitor public and private healthcare providers, and so that they will also have the power of enforcement, redressal, as the case may be. Whatever is needed, it will be done. Now UHC under this regulator will have some issues. So this regulator will oversee the contracts, accredited health care providers. It will also develop ethical standards for care delivery. It will enforce patients' charter of rights and takes other measures to provide UHC system support for the national health package as to control entry, quality, quantity and price. And the national authority will be linked to similar state level institutions and to the ombudsperson at the district level, especially to handle the grievance redressal. So thank you for watching this lesson and continue. Hey guys, what's up? So I'm here with a very important topic of public health, and this is an important topic in science and technology, especially paper GS3, as well as it will help you in your prelims, as well as it will help you in your interview, it will help you in your essay, it will help you everywhere possible. Here we will talk about the universal health coverage in 2017, and this is presented by me, your friend and educator Roman Saini. So the previous lecture was on the National Health Policy 2017. So public health we are dividing into various parts. So let us discuss the universal health coverage part 1 here. So in universal health coverage, whenever you have this doubt, so universal means everyone has to be covered. It is not like for the entire world, it is for India. Health means, obviously health coverage means that everybody should have access to it. It should be affordable, it should be accessible, it should be available. Then what is the background of this? Why do you need universal health coverage to begin with? That is an important question which you need to ask yourself. Then introduction, we will see what is universal health coverage. Then why health for all is important. Then we will see various frequently asked questions when it comes to universal health coverage, like how is it feasible economically, etc. So what UHC is not. Many people think that universal health coverage will have this also, but technically it does not have that. Then principles of universal health coverage in India, because it has to be very country specific. For example, universal health coverage of UK will not work in India because of the resource crunch and the population. Literally, like UK has like maybe like 6-7 crore people, but here you have like 120-130 crore people. Then challenge to achieve UHC by 2022, benefits of universal health coverage for India, and various initiatives obviously taken by Government of India on the universal health coverage day in 2017. So this can be a very good essay material for you. So why do you need universal health coverage to begin with? Now this is a very important question. Everybody should ask this question. So consider the following fact as per the World Health Organization. So if you know these facts, try to memorize them and quote it in your answers. At least half, 50% of the world's population still do not have full coverage of essential health service. Can you believe it? In 2017, 50% of the world population do not have full coverage of just the essential health services. About 100 million people are still being pushed into extreme poverty. 100 million people, 10 crore people. Okay, those who are living on less than $1.9 or less a day, because they have to pay for healthcare. And healthcare is very expensive, it's not cheap. Over 800 million people, that is roughly more than 12% of the world's population, spent at least 10% of their household budgets to pay for healthcare. Can you believe 10% of the entire budget is going on in healthcare expenditure? It is huge, sir, it is huge. Now all the United Nations member states, they have agreed to try to achieve sustainable health coverage UHC by 2030 as part of the SDGs. What is SDG? SDG is basically Sustainable Development Goals. All the members of the United Nations, they have agreed to achieve this universal health coverage by 2030. Very, very important. Now let us talk about a brief background about universal health coverage. How does it work? So Universal Health Coverage Day, which is also called as UHC Day, it was first commemorated on 12th December 2014. It marks the anniversary of the landmark United Nations resolution. So this is a very important point. In December 2012, the United Nations passed a landmark resolution which endorsed the universal health coverage. They said, yes, it should be there. And if you start now, then at least it will take 20-30 years before it actually materializes. In September of 2015, the achievement of universal health coverage was basically enshrined in the United Nations Sustainable Development Goals, and it was made a key target to be reached by 2030. Obviously, we are not going to achieve it by 2030. तो मैं लिख के दे सकता हूँ, but still we should aspire towards it. It has been called the single most powerful concept that public health has to offer. Universal health coverage. Everybody should be covered. Everybody is excited. Now let us talk about basic introduction. So as a state is MyBAP of citizens, so it is the obligation of the state to provide free universal access to quality healthcare services to its citizens. Now, India continues to be among the countries of the world that have a very high burden of diseases. Now, the various health program and policies in the past have not been able to achieve the desired goals and objectives. So, let us talk about the 65th World Health Assembly, which is there in Geneva. It identified universal health coverage as the key imperative for all the countries to consolidate the public health advances. And accordingly, the Planning Commission of India constituted a high-level expert group on universal health coverage in October of 2010, and this high level expert group submitted its report in 2011 to Planning Commission. So they said that UHC can be started by 2022 in India, and but it's not that easy, obviously. So what is this universal health coverage according to you in your own words? So universal health coverage, sorry for this. So it refers to a scenario where everyone is covered for basic healthcare services. Let's say if I need heart transplant, can I give it to every population? It is impossible, virtually impossible. It is not a part of basic healthcare services. So this is a scheme under which all the Indian citizens will have the right to affordable, accountable, available, appropriate healthcare services of basic assured quality. Okay, and that has to be defined in a published package of services and benefits. Now, it is also a supplemental system of financing to protect the people from increasing medical expenses. So it is to ensure equitable access for all the Indian citizens, regardless of any income level, social status, gender, caste, religion, and they have to give an affordable, accountable, appropriate health services of assured quality, as well as public health services addressing the wider determinants of health delivered to individuals and populations, with the government being the guarantor and enabler, and although not necessarily the only provider of health and related services. You can even partner with private sector, so that is not an issue. So you have the entitlement first, that is the universal health entitlement has to be given to every citizen. You have to, like, in principle agree that each and every citizen who is born in this great country need to have a basic access to healthcare systems. Then second is national health package. It is guaranteed access to an essential health package which is free of cost, cashless, inpatient and outpatient both. So outpatient means when you go to doctor and he just sees you. Inpatient is when he bharti you. Then primary care, secondary care, tertiary care, etc. And then you have the choice of facilities or not. So people are free to choose between public sector facilities and contracted private providers, etc. So that is like a true universal health coverage India level. Now, universal health coverage means everyone can access the quality health services they need without any financial hardship. They'll need not go through this financial hardship. So, who all the people, and they especially will include the poorest and the most vulnerable group like Antyodaya, those people, extremely poor. What full range of essential health services, including prevention, treatment, hospital care, pain control, etc. And how are we going to do that? How are we going to achieve this Herculean task? So the cost will shared among the entire population through prepayment and risk pooling rather than shouldered by the sick alone. And access should be based on need and unrelated to the ability to pay. So thank you for watching this lesson. Hey guys, what's up? So we are discussing universal health coverage, and public health is the important theme. And we have already discussed what is universal health coverage and what is mandate, background, introduction, what is the definition of universal health coverage. So if you have not watched those lessons, please watch them before moving forward. Why do we need health for all in the first place? Like, who asked us to do this? Then various FAQs related to universal health coverage. We have already covered various FAQs related to universal health coverage. So now let us see what universal health coverage is not. So basically by definition what it is not. Then principles of universal health coverage in India, and how the India is planning to achieve universal health coverage by 2022, which is the vision. And if you read the economic survey also, it also talks about the universal health coverage. So it becomes very important and very pertinent for us to understand what are these principles and how are we going to achieve it in the next 4 years. Okay, also already like 2018 is starting. So universal health coverage we have already defined, but it is also important that we exclude certain aspects, because then the expectation of people is very very high. If you do not tell them this is not there in universal health coverage, only then you will be able to satisfy them. So as per WHO, there are many things that are not included in the scope of universal health coverage. So the first and the foremost thing is, universal health coverage does not mean free coverage for all the possible health intervention. For example, let's say tomorrow you eat golgappas on the roadside and you develop, let's say, hepatitis A, and you undergo acute liver failure and you need liver transplantation. Now the cost of liver transplantation can vary between 25 lakhs to 50 lakhs in the various hospitals of the Delhi, and that cannot be covered for free. Like similarly, let's say you have an infection and then your heart valve fails, and then you are having an issue with your heart and you want to get them valves replaced. Again, like, that cannot be done. So all the possible health intervention cannot be provided free regardless of the cost, because no country can provide all services free of charge on a sustainable basis. Because if the government start to do liver transplant, and let's say there are 100 such cases of liver transplant, so that is like amount to 40 crore 50 crore rupees. Who is going to pay this money? So that will be a very big issue. So universal health coverage will involve not all the possible intervention, but cheap intervention, economic intervention. For example, it will include all the vaccines, it will include treatment of malaria, dengue, all these things which are very very cheap and it are potentially life saving, and it will impact millions of lives. Let's say diarrhea, it's so cheap, it's like in 1 rupee you can treat diarrhea using ORS sachets. So it's that simple, like the basic diarrhea I'm talking about. Even with the severe diarrhea you can treat it in less than 100 rupees, and if you can do it at mass level, then it can impact the lives of millions and millions of children who otherwise would have died. So first point is, it does not mean free coverage for all the possible health intervention, okay, because it cannot be done on a sustainable basis. This is the first point. Second point is, universal health coverage is not just about health financing. It does not mean that, okay, I am having diarrhea today and I went to AIMS and then my bill was 1000 rupees, so universal health coverage, what it will do is they will provide 1000 rupees on my behalf. No, it is not an insurance scheme. It encompasses all the components of the health system. Okay, it has to ensure that the health service delivery system are functioning, there are personnel, capacity building is done, there are enough doctors, there are enough health workers, the health workforce is there, then the facilities are in optimal shape, communication network is there, then health technologies are there like MRI, CT scan, all these machineries are available, information systems are generated. Then they also have to ensure that the universal health coverage is providing of at least minimum quality has to be provided there, and various governance and legislation feature as well. Now, universal health coverage is not only about ensuring a minimum package of health services, but it is also about ensuring a progressive expansion of coverage of health services and financial protection as more resources become available over a period of time. So, do you understand this? Let's say you started with okay, we will provide all the vaccination, we will treat all the disorders given in IMNCI, that is integrated management of neonatal and childhood illnesses, and we will provide free delivery, we will provide weekly iron folic acid supplementation, like basic services, minimum package, okay. But let's say the government gets more money, more budget gets put into the health, so progressively you will need to include more and more stuff in that. Okay, then tomorrow you say okay, malaria and dengue treatment is included, then after that you say let's say basic surgeries like removal of appendix, or let's say like mammectomy, if there are any uterine issues, basic surgeries are also covered. So you have to progressively expand it. So all these things, and mastectomy basically means, let's say if you have a breast cancer, so removal of the breast is called as mastectomy, just to give a context. And financial protection has to be provided because more and more resources will become available over a period of time, so you cannot stick to the same minimum package of health services from which you started. So this is not universal health coverage. Now, universal health coverage is not only about individual treatment services. Again, it is also about population based services. Let me talk about what is population based services. So let's say you have a lot of dengue cases. So at population level you can kill all the mosquitoes, you can put oil in their water and they will not breed. So that is a population level agent. You can distribute condoms in the entire population so that the AIDS prevention and STD prevention can be done. So that is like a population level intervention. If the water is lacking in fluoride, then you can add fluoride to the water. You can do public health campaigns regarding not using needles if you are a drug addict, etc., and controlling mosquito breeding grounds and so on. There are so many public health. So for example, cholera was treated when the sanitation was improved, so it has nothing to do with anything else. Fifth point is universal health coverage is much more than just health. It has to take steps towards UHC, meaning like equity, development priority, social inclusion, cohesion. So all these things, all these aspects are included in the universal health coverage. Now, guiding principles of universal health coverage in India are 10 principles. So try to remember these 10 principles, okay? So universality, equity, non-exclusion, non-discrimination, obviously you can read article 15. Comprehensive care, which is rational and of good quality. Financial protection, protection of patients' right that guarantee appropriateness of care. Patient choice, portability, continuity of care. Consolidated and strengthened public health provisioning. Accountability and transparency. Community participation. Putting health in people's hand. So try to remember these 10 points and at least write 7 8 if they ask in the exam. So by 2022, every Indian citizen will be covered by a national health package, that is choice of facilities guaranteed by the government. The package will cover free of charge all primary, secondary and some tertiary services. Entitlement is basically universal health entitlement to every citizen, and it will have primary care, secondary care, tertiary care. And choice of facilities is between, you can choose between public sector and contracted and private providers. Thank you for watching this lesson. Hey guys, what's up? So we just covered like what is the universal health coverage principles which guide in India, what is the universal health coverage by 2022, what is the vision India is trying to achieve, and according to WHO which principles are not included in universal health coverage as of now, how are we going to expand it in the future, and why only basic services are included and not everything else, because it has to be made sustainable. So that is, we have discussed about universal health coverage. And now we will discuss the part 4 of universal health coverage in this particular lesson. And here Like we have already covered why do we need universal health coverage, background of it, introduction of it, what is universal health coverage. So this was discovered in the first lesson. Why do we need health for all, various frequently asked questions related to universal health coverage, that we covered in the second lesson. And in the third lesson we covered what the universal health coverage is not, principles of universal health coverage in India, and universal health coverage by 2022, the vision. So these things we have covered till now. Now we will see challenges to achieve universal health coverage by 2022 and benefits of universal health coverage for India. So these are the two topics which we are going to discuss now. So there are a lot of challenges to achieve universal health coverage by 2022 for sure, no doubt about it. And there are a huge number of challenges which we need to overcome to achieve the universal health coverage by 2022. And these challenges include that we have the largest disease burden in the entire world. This is one of the biggest challenges. This is the first challenge which we face as a country. Then reproductive and child health problems are there. So that is the second challenge, a huge challenge. Then third is malnutrition. Like malnutrition technically includes both overnutrition and undernutrition. So it will include obesity as well as marasmus, kwashiorkor. But malnutrition in general sense, if a lay person is asking, then it means like undernutrition. Then issues of gender equality there, like India is really bad when it comes to gender equality. And it is not just sex ratio, it is about the opportunities, female feticide, infanticide, and financial resources are not that much spent on the female child as compared to the male child in the family. And this is especially true of the northwest India. Poor availability of trained human resources in health. There is a huge dearth of doctors and a lot of quacks practice medicine in India. Quacks basically means those people who call themselves doctor but they do not have a MBBS degree, okay, or they are not a recognized doctor under the any of the healthcare system of the India. Now, inadequate research to achieve healthcare for all, commercialized, fragmented, and unregulated healthcare delivery systems. So that is also there, and there is a huge inequality in access to healthcare. So let us talk point by point. What do you mean by largest disease burden in the entire world? So you talk about any disease. You talk about disease of the rich people like non-communicable disease, lifestyle disease. We are the world capital. For example, diabetes, metabolic syndrome, obesity. Okay, all this like India is one of the like hypertension, cardiovascular disease, stroke. All this we rank number one in almost half of these diseases. Then you have reproductive and child health problems. Yes, a huge problem is there. Patients are anemic, they get married at less than 18 years of age, and then they deliver children as a teenage, creates a lot of issues. Malnutrition, I will not go in detail, but you know what is the problem. Gender equality is there. No nurses are enough, like no doctors are there, no super specialists are there, not specialists are there. Everybody is in like basically dearth is there. Then there is inadequate research obviously, and finally there is inequality in access to healthcare. Not everybody can access the same healthcare. Then there is a huge imbalance in resource allocation. That point also you need to understand. Like the urban area get like let's say almost 90% of the resources, rural areas hardly get 10% of the resources. Even I don't think it's even 10%. High out of pocket health expenditure. What do you mean by out of pocket expenditure? For example, you go to let's say a government hospital, let's say AIMS. Then you will register yourself, you pay 10 rupees, you go inside, you see the doctor. Doctor says get these tests done, test cost 1000 rupees. You come back, doctor says buy these medicines and come back after 1 week. So you buy these medicine again, it costs 1000 rupees. So till now you have spent 2010 rupees, right? So that is your out of health pocket expenditure because that is not covered by the government. Let's say you have some serious illness and they ask you to do MRI, CT scans. That will cost like 4000, 5000 rupees, and so on and so forth. So that will not be economically sustainable for you. Then rising aging population, as seen in Japan, you will see a lot of old people in India in the time to come, because what is happening is these old people are growing old because of the increased life expectancy, decreased death rate, increased health facilities, and as you increase, as you become old, more and more health problems arises, and there is a separate branch for it. It's called as geriatric medicine. Now, social determinants of health, poverty, illiteracy, alcoholism. This is a very big challenge. If you have an alcoholic in the family, it's very difficult to come out of the poverty trap. Then too frequent, too severe natural disasters. Obviously, ask people living in Odisha, ask people living in various parts where have earthquakes, tsunamis, and whatnot, cyclones. Then lack of intersectoral coordination, that is also there. Like in two departments of the government, there is a very minimal coordination. Political pull and push of different forces and interest. All these points are there. Anybody who lives in India knows about it. Now, what are the benefits of universal health coverage for India? So, universal health coverage will confer a lot of benefits for India. It will provide financial protection to people by reducing out of pocket health expenditure. It will promote greater health equity by promoting better access to health care for all the sections of the population. So, try to understand financial protection will be there because many people go into poverty when they have to, let's say, spend 20,000 rupees on the care. It will promote greater health equity, okay, by promoting better access to healthcare. Everybody can access healthcare. It will improve health outcomes at each and every stage of a person's life by improving the quality of health services and the effectiveness of their delivery. Fourth point is it will make the health system more efficient and accountable by defining health service norms, establishing credible and effective regulatory systems, promoting transparency in procurement contracts, mandating quality through accreditation, monitoring, etc. So all this has to be done by the government, and we have to ensure that each and every stage we are very vigilant. Now it will also reduce poverty by reducing the risk of ill health in the first place, because you are already spending a lot on preventive medicine like prevention of dengue, prevention of diabetes, prevention of hypertension, prevention of malaria, prevention of AIDS. So because it is reducing the risk of ill health, so it is automatically reducing your chances of becoming poor in the first place. And it will also reduce personal cost just in case if disease does occur. It will improve your productivity by promoting your health. A healthy person can work more, harder, and longer. And it will reduce the loss due to premature death, prolonged disability. So, all these things can be taken care of. It will create several million jobs through much needed expansion of the health workforce. Not just the doctors, there are other people from Ashas to Anganwadi workers. And young persons and women will specially benefit from the creation of new jobs in both the public and private sectors. So, thank you. Hey guys, what's up? So in the last lesson we were discussing benefits of universal health coverage. So let us finish this course by discussing the last bits of the universal health coverage which you need to understand, and if sometimes they ask you essay on this topic then you know you're very well prepared. So let us discuss the universal health coverage. This is the last part of the universal health coverage. So we have discovered why do we need universal health coverage, the background of the universal health coverage. We have discovered the introduction to the universal health coverage. We have discovered what is universal health coverage. Then we discovered what is universal health coverage is not. Why do we need health for all? Frequently asked questions by universal health coverage. Principles of universal health coverage in India. Universal health coverage by 2022. The vision. Various challenges to achieve the universal health coverage by the year 2022. Benefits of universal health coverage for India and initiatives of Government of India on universal health coverage day 2017 is the final topic which is left. So let us talk about various initiatives of Government of India on universal health coverage day 2017. So first of all, the theme for 2017 is health for all, rise for our right. So please remember this theme, they can ask you in MCQs. So initiatives of Government of India on universal health day, it includes launched Lakshya and M Health Safe Delivery application on the occasion of UHC day. Who launched it? MOHWF. So Ministry of Health and Family Welfare, HFW. Okay. So other initiatives, Lakshya is one, and M Health Safe Delivery applications. Other initiatives includes, so National Health Policy 2017 will envisage the attainment of the highest possible level of health without anyone having to face financial hardship as a consequence. So this is the first point. Then you have Mission Indradhanush. So it is one of the largest global public health initiative. It was launched in year 2014, and in the 4 phases till date, Mission Indradhanush has successfully reached over 25 million children in over 528 districts. And since 2014, rotavirus vaccine, pneumococcal conjugate vaccine, measles rubella vaccine, and also the Japanese encephalitis vaccine for adults, they have also been launched. So Mission Indradhanush is like seeing lots and lots of stuff where you are providing a lot of vaccinations to children, and it is helping them a lot. Then you have Pradhan Mantri Dialysis Program. So let me just briefly tell you what is dialysis. Let's say you have a kidney infection, your kidney stops working, and in that case your body will start to accumulate a lot of toxic stuff like urea, and in that case your body will not work at this efficiency, and if it continues for long you might even die. So to remove that, artificial kidneys are available outside. It's very easy, it's not difficult at all. And even like if you are waiting for a kidney transplant, you can even do it for 1 year, 2 year, 3 year, 4 year, 5 years. So that is the called as dialysis, where you have an artificial kidney which removes the waste products. So it has been launched to provide free services through dialysis units under free drugs and diagnostic programs. Amrit outlets have also been established to provide subsidized medicines and to provide comprehensive primary care. The government has announced transforming 1.5 lakh sub-health centers to health and wellness centers in the country. Now, universal screening of common non-communicable disease includes like diabetes, hypertension. So these are very common non-communicable diseases which are present in the entire population. Especially India is called as the diabetic capital of the world. Hypertension is also very common. Hypertension means hyper means increased, tension means pressure. So increased blood pressure is called as hypertension. Then there are common cancers at the sub center, like various common cancer, oral cancer, cervical cancer, breast cancer, lung cancer. They are so common in India. And at primary health center has been initiated so that people can get screened, because most of the rural people, they either visit a sub center, so which is the lowest level of health establishment. Then you come primary health center, then you have community health center, then you have a district hospital, then you have like a tertiary care hospital. So following are the components of National Health Mission of India. So Lakshya is basically labor room quality improvement initiative. So just remember this point, Lakshya is labor room quality improvement initiative. Now there is a huge evidence that supports the fact that improving the quality of care, labor room, you understand what is the labor room? When a pregnant woman comes, we take them to a labor room when they are about to deliver. Especially on the day of birth, it is central to maternal and neonatal survival. And recognizing this fact, Government of India has launched Lakshya. Lakshya is labor room quality improvement initiative. Okay, labor room quality improvement initiative. It is a safe delivery mobile application for health worker who manage normal and complicated deliveries in the peripheral area. Now using this app, what we can do is, it will reduce preventable maternal and newborn mortality, morbidity. Mortality means death, morbidity means diseases, and stillbirth. Stillbirth means when a baby is born and they don't take a breath, so they are basically born dead. So they are associated with the care around delivery in labor room and maternity OT, and ensure respectful maternity care. So that is basically Lakshya. Now its objective is obviously to improve the quality of care provided to the pregnant mother in labor room, maternity operation theaters, because right now there are very few quality standards that is maintained. People don't maintain sterile environment. People like it's a very very bad scenario as a doctor, I can say. So that undesirable adverse outcomes associated with childbirth can be prevented. Now it will be implemented in the following: all the government medical colleges, district hospitals, high delivery load sub-district hospitals, community health centers, CHCs, etc. So Lakshya will be like there again: government medical colleges, district hospitals, sub-district hospitals which have high delivery load, and community health centers. It plans to conduct quality certification of labor rooms and provide facilities to achieve outlined targets. Then you have M Health Safe Delivery mobile application. So Safe Delivery application is an M Health tool that can be used for health workers who manage normal and complicated deliveries in the peripheral areas. Now application has clinical instruction films on key obstetric procedure which can help the health workers translate their learned skills into practice. It can also play a pivotal role in training, post-training reinforcement, mentoring and demonstration. And this application basically has been tailored as per the Indian context. So just remember, M Health is safe delivery mobile application. Then examples of use of modern technology in health service includes M Health. M means mobile health. So it's a term used for the practice of medicine and public health, which is supported by a lot of mobile devices. Now it has emerged a sub-segment of e-health. E-health is basically use of ICT for health, like computers, mobile phones, communication satellite, patient monitoring, telemedicines, etc. M-Health application, what does it include? It includes the use of mobile devices in collecting community and clinical health data, delivery of healthcare information to practitioners, researchers, patients, real-time monitoring of patient vital signs, direct provisions of care via mobile telemedicine, etc. So this was about the universal health coverage, and I hope you enjoyed it. So try to memorize all the points which I have told you. This will not only help you in GS paper 3, which is related to science and technology, because public health is a very important topic there, but it can also help you in writing a very awesome essay on the health of India. So thank you.